Mamoni is a USAID-supported project implementing an integrated package of maternal and newborn health and family planning services to a catchment population of 3.5 million in Sylhet and Hobbyganj districts in Bangladesh. In Jointapur Upazila in Sylhet district, it was found that neonatal mortality has been at a standstill even after a few years of behavior change interventions. Thus, the Mamoni project began the implementation of an intervention targeting newborns in this moderately low neonatal mortality setting. Community health workers are the first-line service providers. They are responsible for routine household visits performed by family welfare assistants of DG Family Planning. The community health worker lists pregnant women and updates the pregnancy register through bi-monthly household visits, through bi-weekly meetings with the community volunteers, and through regular communication with the volunteer and other information channels. She follows the list of pregnant women and suggests every one of them to visit the family welfare visitor or any skilled provider if the family welfare visitor or SACMO is not available for antenatal care services, preferably at the satellite clinic. She uses an algorithm to assess the risk level and categorizes pregnant women as recommended. If risk level remains up to 1 as per the algorithm, she advises for delivery at a facility, but if risk level is 2, she calls the paramedic for a reassessment. The community health worker visits the house of a newborn first within the 6 hours of its birth, then again on day 3, day 7, and finally after day 28. Before assessing the newborn, she washes her hands properly with soap and water. She also uses the Salter scale to weigh the baby and checks the baby's temperature with a thermometer. She conducts a physical examination following the algorithm and assesses the risk level in the newborn. She uses the algorithm in every visit to identify the risk level. If it is found to be 2, a paramedic is called for a reassessment.
Hello. নমস্কার ভালো আছেন ওই দিদি আমি ওই যে 9 নম্বর ব্লক ওই যে অঞ্জনা দাস তো তান বাচ্চাটা আর কি আমি লেভেল 2 পাইছি আমার অ্যাসেসমেন্টে আপনি বাচ্চাটারে আইয়া একবার দেখিয়ে দিন
On receiving a call, the paramedic turns up at the household and cross-checks the community health worker's Risk 2 categorization of newborn assessment. She follows the same algorithm while reassessing the newborn. She then arranges timely referral to ensure appropriate care and management of the newborn at risk and accompanies the sick newborn, if necessary, to the special newborn care unit in Jointapur Upazila Health Complex. There is eminent coordination between the paramedics providing domiciliary services and one referral coordinator at a coordination center in the Mamoni Upazila office. The SCANU is a special care newborn unit that provides essential newborn care services and is equipped with necessary logistics and life-saving machines and medicines. Special equipments in the SCANU that are not available even in Osmani Medical Pediatric Department are the radiant warmers and phototherapy machines. The radiant warmers are of the latest version with digital displays, skin sensors, and oxygen hoods. A team of 4 medical officers and 6 nurses work round the clock to provide services at the SCANU under the local supervision of the UH and FPO. The referral coordinator or paramedic ensures that the baby and family are well received at the facility, having sorted out all arrangements for treatment. Sepsis dominates 42% of the newborn cases, while asphyxia represents 33% of the cases, which are most common. Preterm cases are more critical, which contribute to 12% of total newborns with complications. The project works on demand creation through the community health workers and volunteers. Side by side, for identification, assessment, and referral of sick newborns, data captured by community health workers are compiled to produce monthly reports that are essential for program monitoring. The performance from the SCANU is similarly compiled to produce monthly reports to categorize sick newborns and to track their prevalence. Individual case records are uploaded regularly in the District Health Information System 2, the official web-based database of DG Health Services. The Mamoni project is implemented by Save the Children and local NGOs Shimantik and FIVDB. BSMMU provided technical assistance to set up the SCANU, to develop the algorithm, and to set up technical standards for sick newborn management. A pool of consultant pediatricians of Osmani Medical are engaged to ensure quality of services from the SCANU. Every week, one consultant pediatrician visits the SCANU for review of case records and further management.